from the All Indiana Podcast Network. This is Wish TV's Behind the Eight.
What's on the program for this fine day?
McKinzie Roth takes you behind the scenes at News 8.
Sounds like a great program.
It is amazing.
Now, here's Wish TV's entertainment insider, McKinzie Roth.
Hello, hello, hello. Back at it again. Welcome to another episode of Behind the Eight. I'm McKinzie Roth, entertainment insider here at Wish TV at the All Indiana Podcast Network. We are in the pristine studio, and joining me now, he is the man that makes everyone more beautiful and more confident. Dr. Gregory Chernoff joins us.
Thank you for having me. Thank you. It's always a pleasure.
You are so busy, so thank you for your time. I really appreciate you joining us. There's so many questions having to do with skincare, self-care, making ourselves look better. Obviously, there's a multitude of shows out now, but let's talk about first of all, Dr. Chernoff, how you got started in your industry.
Well, all I used to do almost 30 years ago was head and neck cancer surgery. So I used to have to cut off jaws, cut out tongues, and you don't need the fibula in your leg. So it was about a 20-hour operation to bring up the fibula with all of its tissue and reconstruct a jaw and a tongue. The main problem was that the majority of my patients were big-time drinkers and smokers that wouldn't stop. So I was doing this for them only to see them, because they wouldn't change their habits or lifestyles, develop a recurrence and die usually within 3 years. So I started asking them, have I done anything to improve the quality of your life? Most said no, because they were having to come for follow-up for almost 3 years. I asked them, would they have done it again? Most said no. I probably would have just gone to some beach and drank and smoked myself to death for my last 6 months.
Interesting.
So I enjoyed I loved the surgery, but it wasn't very gratifying. So that's when I converted my practice to 100% cosmetic, because now I operate on and take care of fairly stable people looking to make a positive change in their lives. And the most gratifying part of what I do every day is just watching how the smallest changes can make such a huge difference in self-esteem. All of us have a sense of self-esteem, and all of us have features that we'd like to improve upon if we could. And the beauty for patients now is that there's so many choices, both non-surgical and surgical, really based upon what it is that is your first choice of what you want to improve. And so that's the benefit of coming in for a consultation, the benefit of us having computer imaging, because we can put you on the computer, show you various possibilities. You'll never go wrong by doing what bothers you the most. But when you come for a consult, I'll simply give you my artistic impression as far as what I see, and help you with a long-term plan. I'm much more interested in 20 years with all of my patients, as opposed to just doing something to you. And that's the trust and the loyalty that we seek to develop.
What can 160 years of experience teach you about the future? A lot, especially when it comes to protecting what matters. At Pacific Life, we've helped people and businesses confidently embrace the future with life insurance, retirement income, and employee benefits, with strategies built on strength and trust, and a promise to be here for you today and tomorrow. Ask a financial professional how Pacific Life can help you today. Pacific Life Insurance Company, Omaha, Nebraska, and in New York. Pacific Life and Annuity, Phoenix, Arizona.
If you're shopping while working, eating, or even listening to this podcast, then you know and love the thrill of a deal. But are you getting the deal and cash back? Rakuten shoppers do. They get the brands they love, savings, and cash back. And you can get it too. Start getting cash back at your favorite stores like Target, Sephora, and even Expedia. Stack sales on top of cash back and feel what it's like to know you're maximizing the savings. It's easy to use, and you get your cash back sent to you through PayPal or check. The idea is simple. Stores pay Rakuten for sending them shoppers, and Rakuten shares the money with you as cash back. Download the free Rakuten app or go to Rakuten.com to start saving today. It's the most rewarding way to shop. That's RAKUTEN, Rakuten.com.
Being on television, I mean, we do get scrutiny. It's kind of like when people say, hey, Kinsey, I need advice getting into this industry. I was like, you really have to have a thick skin, literally, because people pick you apart. They see you on TV, and they could be, you know, as I always say, consider the source, because
especially with digital now,
exactly.
Doesn't
it's
hide
like, how are my
anything.
pores? Zoom out. You must see a lot of things. You're like, oh, I could just help. Because it's interesting, because if you go to the coast, the people you see on the news are like a little different than we are a little more conservative here in the Midwest as far as like procedures and things go. What are let's start with the signs of aging, because everybody, I mean, it happens to all of us. You're not going to escape it.
No. So whether Whether you're a television personality or not, we all go through the same signs of aging, above the neck and below the neck. Number one is the gravitational descent of your muscles. As we age, our forehead muscles weaken. As that happens, your eyebrows start to fall. Usually, we like to see the head of a female brow sitting on the bony eye socket with the tail sitting a centimeter above. If the heads of your brows fall faster than the tails, again, that tends to give that's good.
Yeah.
That's good for business negotiating and raising kids, but it gives you a bit of a stern look.
And it's really not fair because all of a sudden you're like, whoa, that wasn't here before, or it just kind of subtly starts, and then it's a real issue for you.
Sure. And that's then when people start coming in saying, I'm here because of comments that have been made to me that have had a negative effect on my self-esteem. Are you angry when you're not? If the tails of your brows fall quicker, that's called lateral hooding, and that can give you a tired look. So if you've had 8 hours of sleep and someone's asking if you're tired, that can wear on you.
Yes.
As the gravitational descent then affects your midface, we start to see a deepening of our tear troughs and an accentuation of the fat pads that your eyeballs sit on, causes the bags under the eyes. As it continues downward, you see deepening of your marionette lines. You get a downward turn to your mouth.
So sad.
You start to see the jowling and then the banding in the neck.
Oh, man.
So many of the gravitational descent aspects require surgery, or we'll talk about something new that's called face tight and body tight and acutite in a moment. The second sign of aging that we go through is volume loss. We lose fat in our faces as we age, both in the mid-face, that causes a flattening of the mid-face. Women lose more fat around their mouths, so that we start to see the vertical lip lines, all of the lines around the mouth. And that's where now you're just seeing where your skin's attached to the muscles that operate your mouth without the intervening layer of fat.
I always feel bad for people that really go through like a cool life change and they lose all this weight, but then it's like they have to deal with the skin.
Then there's repercussions. And that's the third sign of aging, the loss of the tone, quality, elasticity, and clarity of skin. The number one side effect of hormonal changes in women, whether it's being pregnant, being on the pill, perimenopausal, postmenopausal, is pigment variation on the skin, where we start to see a lot of splotchiness. So our goal, and we'll talk about the things that we use to do that, we would really like to have any woman be able to just wear eye makeup if she wants and not have to put on any makeup.
Because skin is the foundation, I feel like. You have to have your skin on point, and it's worth the investment. It kills me when women are like, oh, they don't want to spend for a facial, or they don't want to. It's like, it's that self-care is so important.
As we speak at a lot of the meetings that I talk at, we speak now in terms of generational aesthetics. So I'm starting to see patients as young as 12, 13 who, as they enter their periods, they have problems with unwanted acne. So their skincare needs are different than from the older teenager whose needs are different than from someone in their 20s to 30s. Then we get into premenopausal skin, postmenopausal skin, and I'm seeing many patients now 70 through 90, with healthcare being what it is. People are living longer. So these folks come in saying, I don't feel my chronological age, but the person that I see in the mirror doesn't match how good I feel.
Right.
So if you have something safe that can help me, I'm really interested. And we're seeing a bigger push now to the concept of preventative aesthetics as opposed to corrective aesthetics.
Right, get it before it happens.
More
right.
And skincare is really like going to the gym. If you and I go regularly, we'll see a nicer result than if we go sporadically. If we go and use all of the equipment, we'll see a nicer result than if we just use the biceps machine. Skincare is no different.
I was going to ask you, some women, they'll spend hundreds and hundreds, and men too, on these creams. And when is the moment where you say, I really need to have like a procedure? Because someone might spend thousands on an eye cream. It's like, you really need to be doing Botox. You really need to like step up your game here.
It's really when the gravitational descent is what bothers you the most. There are really very few non-surgical procedures that are really worth your money.
Yeah.
So the most common combination that we would do from a surgical standpoint, and anything that I'm going to mention is still considered minimally invasive with minimal risk, 1% to 2%, which infection and bleeding would be number 1 and 2. Minimal pain. Most of our patients are on Tylenol by day 2 or 3. I think everyone hates me for the first day or 2, but thereafter they
hate you, but then they love you. Right.
And minimal downtime. Any of these surgical procedures that we talk about, most patients, if you don't want anyone to know you've had it done, and that's always our nicest compliment, is when no one knows.
That's what you want. You want, wow, you look amazing. You look refreshed. Not
who did that to you.
Right. Yeah. Because, are you flabbergasted when you watch shows like Botched or these shows where it's like the huge lips, like almost the animated features?
Anytime you and I can walk into a room and tell that someone has had something done. That's not an aesthetically pleasing result. And that's really shame on the provider, whether it's a nurse injector, whether it's a physician, because even though it's inherent for me to want to please you, you're still a walking example of what I do.
Right.
And so we never want anyone to know. We just want to keep you looking. We've coined the term your natural best, and that's what we want. We want you to look your best, look rested. The whole concept of attractiveness and what defines a handsome man is really based upon your outward projection, but also what you're projecting from the inside as well. Mm-hmm. So we help our patients with that as well, because someone could be what you and I perhaps would score them as a 9 out of 10 on a beauty scale or a handsome scale.
Sure.
But when they open their mouth and we listen to them, that brings their level of attractiveness down to a 2 or a 3.
Dr. Chernoff, I've experienced this daily on the dating world. You're like, wow, and then their number falls. But, okay, so and we have to talk about, obviously we're all wearing masks now, and so this is really affecting people's skin, right?
Very much so. So there's tremendous science in skincare now. One of the hottest new products out is a product. The new name for it is N101 that's being launched, and it's a dual chamber device where when you mix the contents of each chamber, it creates a gas called nitric oxide. And we've completed 2 published studies, one on aging skin, one on blemishes and acne. And we found that topical nitric oxide is really tremendous for stimulating your own cells in your skin called fibroblasts, the cells that are the computers of the skin responsible for improving the tone and quality. We know that topically, nitric oxide gas has a tremendous antibacterial, antiviral, and antifungal effect. So I've been seeing with COVID, we're seeing a lot of mask perioral dermatitis, where people are getting a lot of outbreaks around,
the new hot word,
around their mouths. Topical N101 helps to really remedy this within days.
That's cool. And it's fun because it's a dual pump.
It is.
So you kind of feel like you're a little scientist when you're putting this on. I've got to try it and I absolutely love it.
And it's really one of the few products that I'm involved in a lot of FDA studies and a lot of studies helping to launch products. This has been one of the few products where, and I'm a non-believer in these products until my patients prove it otherwise. This has been one of the few products in 30 years where without exception, patients love it. And so we've really been excited with that. And people, by and large, when they come in for a consultation, I ask them to bring in what they use. And most of the time, people bring in shopping bags full of products that they'd be better off drinking than putting on their skin for all the good that they're doing.
Oh, man. So, and think about all that money wasted. That's the sad thing.
So I've worked with the same chemist for over 20 years from New York, and we private labeled our line. What I've learned about at-home skincare is if you don't keep it simple, people won't do it. If you don't keep it affordable, people won't do it.
Right.
So the Gregory line is very affordable, and we have a very high satisfaction rate. But then there's many different specialty products. The most popular within our office is one line from Italy called Underskin, and they have first very beautiful packaging, but a line of products that really works, a line of products that has tremendous science behind it. Made in the USA, the line called Definage. Is again a line you'll hear a lot about cellular medicine, regenerative therapy. Definage, there's nothing else like it. It's the first topical that applies stem cell therapy using protein.
Definage, because you're going to ask me
Correct.
what this is. I am trying the BioSerum.
Yes.
I got a little sample and then I was like, give me more. It's so good. I haven't got to experience the whole line, but that BioSerum is awesome.
It really, whenever I've seen you without makeup, you just have a healthy glow to your skin, and that's what patients describe.
I swear I did not pay him to say that. Now you're so sweet.
That's $5. But people,
I saw you without makeup and I was horrified. No, that's the goal, right? You want to wake up looking refreshed. Do men lie, Dr. Chernoff, when they say, I love a woman the most when she first wakes up in the morning? Or do you think that's accurate?
I think that depends who they're sitting beside and who they're talking to.
I love that is our goal, though. That's why we want like little beauty hacks and little things we can use, the best products to use, because I don't want people wasting money. So,
and look how much time in your life you would have saved if you didn't have to put makeup on.
Yeah, no, that's absolutely correct.
And taking it off.
Yes. I mean, I want to talk to you because a lot of my girlfriends, so I'm in my 30s, and now we're noticing hooding like eyelids. Things are getting a little heavy. And so you can only Botox so much. But people want to know, when can you do, like lasers or Botox, and when do you actually need to do like cutting?
So any of these things that we're talking about anymore aren't age related. It's when the feature bothers you enough, and when anatomically you have a feature that I could justify to 10 of my peers. If I had 10 doctors in the room that do what I do, and I said, this patient has eyelid hooding bad enough to warrant a blepharoplasty or an eyelid surgery. Mm-hmm. And if I could get a majority vote, I guess no matter what we do in life, we're all victims of how we've been trained. So
sure.
You'll never get all of us to agree on anything totally.
Right.
But a majority vote would be excellent. And the most common combination that I do for patients, and as young as 35, 40, if they've inherited, many patients are born with their father's eyes or their mother's bags under the eyes or their father's nose, or many patients in their late 30s, early 40s, we start to see banding in the neck. We see some early jowling, deepening of the marionette lines. So the most common combination that I do in a single session for patients would be a very subtle brow lift. When I teach this, I always tell doctors you don't want to win any brow lifting competitions.
We don't want any Frankenstein, Spock.
We don't want to give you a deer-eyed look. So the most common combination that I would do would be an endoscopic brow lift. We do that through a tiny little 1-inch incision behind the hairline. A laser divides the muscular connections that hold the brow, which then let me put it back to within a millimeter where we want it. Right after that, then I use a laser to remove the excess skin from the upper eyelid. We use the laser if you have bags under the eyes. We take that, sculpt that fat out from the inside of the eyelid. And then there's many variations of lifting. If someone just has some deepening of the marionette lines, a bit of jowling, there's a procedure called a short scar mid-facelift that can remedy that.
Oh, wow. A lot of the housewives are into that.
Yes.
But I mean, a lot of normal everyday people are as well. We just don't hear about it. Yes.
And any of the lifting that we do is what we do to the muscles under the skin, not the skin. So we can do a short scar mid-facelift. If you have more jowling, banding in the neck, that's then what takes you to the next level of doing more of a traditional facelift procedure.
The neck is tricky because oftentimes I'll see people with beautiful faces that you can tell they take care of their face, but they've kind of forgotten about the neck. And you're like, oh. Does it bother you, Dr. Chernoff, just because you're so on point? But when you watch television, when you watch not just news personalities, but you see people on TV and you're like, oh, they've totally been, or something was done wrong, or that was too much, or look, those lips are too much.
It really, I think fillers are one of the areas that, again, sadden me, because we see many providers blowing their patients up to look like blowfish.
Slippery slope there,
Right. And so, again, whether it's lip filler, cheek filler, the most common combination that we do is a filler called Voluma in the cheeks, Juvederm in the folds, and Volbella along the lip line. But again, do it in a way so no one can tell. You don't want someone walking in, again, looking like a blowfish.
Where does that go? Because I know obviously that doesn't last forever. So does it dissipate and then your body gets rid of it?
Correct. All of the 3 fillers that I just mentioned are in the family called hyaluronic acid fillers. And hyaluronic acid is the same naturally occurring sugar that our own collagen and elastic fibers swim in our skin. It's one of the few substances in nature that's referred to as ubiquitous. So yours, mine, a dog's, a cat's is very similar in composition. That's why when we inject it, your body doesn't fight hard to get rid of it. But over time, your body just absorbs it. Most Voluma patients, Voluma in the cheeks can last up to a year, sometimes up to 2, though usually under the bell curve, right under the bell curve, 1 year. Juvederm in the folds, most people get 4 to 6 months out of. Lips, when done properly, again, can last up to 6 months.
Very cool.
Botox is the most common drug that we use in the office. It's like putting a child-proof cap in the electrical outlet. It's a drug
Right.
that blocks the connection between the nerve and the muscles that block the scowl, horizontal brow lines, crow's feet. It starts to work in 72 hours. Most people get about 3 months out of it. Advanced injection areas that we can do some of the fine lines around the mouth. We can use it for facial thinning and inject a muscle called the masseter muscle. Injecting that area, it's also FDA approved for TMJ syndrome. We can also use it. It's life-changing for migraine sufferers.
Yeah.
and for a condition called hyperhidrosis or excessive sweating. Many people are embarrassed to shake hands because of sweaty palms.
Yeah.
Many women don't like wearing dark tops because of excessive armpit sweating.
It's
life-changing.
amazing.
Life-changing.
This
for
is
those
life-changing.
patients.
And I know you have some life-changing new procedure stuff that we want to know about. So this is just such an interesting world. And I mean, people are obsessed with YouTube, and all of my friends and all the gals. I just, last week, my special guest was a gal named Abby Landrum, and she's 21 and she's a millennial. She's like, I want to be on top of everything before, to know what to do. But people do get overwhelmed because there's so many options.
The internet is really a double-edged sword. It's a tremendous source for information. But that again can be confusing for a patient. So that's the benefit of coming in for a consultation. And in our office, we take the position of giving you information, never trying to sell you anything. Mm-hmm. But what I love about what I do, the technological advancements in my field have really grown exponentially. I do virtually nothing today how I was doing things almost 30 years ago. Some of the newest, hottest products beginning with, we've talked about the topical skincare, but then our esthetician features that we offer. You know how when you go in the ocean or the sea, you come out and your skin feels tighter? That's because sea salt has a tremendous extraction capability of extracting impurities. So instead, the procedure is called the salt facial, and it really combines 3 technologies into one. It too is a made in the USA product. Alan Danto, the creator of this, was brilliant when he put these 3 technologies together. It takes about 45 minutes when you come in. It starts out, instead of doing microdermabrasion with sand crystals, this exfoliates your skin with sea salt.
I've experienced this. 1, it's heavenly, and 2, when you leave, you're like, oh,
again,
my
you have
skin
a beautiful,
is brand new.
You have a beautiful glow. Exactly. Right after the exfoliation with sea salt, we use a deep penetrating ultrasound machine to drive peptide serums into your dermis, and then it finishes off with about a 20-minute. Very high-intensity LED light treatment. All 3 of these technologies have science behind them. When we combine them in the salt facial, really tremendous.
And this is a great gift idea. If maybe gentlemen or maybe even for your girlfriends are looking for, hey, I want to treat my lady or I want to treat my friend, whoever, or even your guy, like a salt facial, a beautiful treatment like this.
The next time you're thinking of buying someone something, buy them an experience that they otherwise wouldn't buy for themselves.
That's
and you'll be amazed at the gratitude that
Better
they show
than
you.
Flowers.
Other than the salt facial, there's a machine that uses cryotherapy or cold therapy called the cryofacial. And so this too has been tremendous for acne, tremendous for blemishes, and again, a very popular treatment. Then when we move on to more of the nurse or physician provider procedures, again, tremendous new science. Probably the most popular procedure that we do in the office is called the DOT laser. It's a fractionated carbon dioxide system. When I put my foot on the foot pedal, it gives off 100 little 0.1 millimeter penetration points.
Wow.
And I can gauge how wide apart the spots are, how close together they are, how deep they go, and how much energy comes out of the portals. So for someone your age who just wants a freshening, you'll leave the office being a little bit pink.
I need this. I've never experienced this.
If
I want to try
someone in their 40s wants a little bit more toning under the eyes, they'll be red for 2 to 3 days. If it's a 60, 70-year-old that I'm treating their whole face to try to get as much shrinkage, they'll be red for about a week.
So you can really customize.
We can, and that's the beauty of it. And this treatment, all of these things that I'm going to talk to you about now are for the quality, the elasticity of the skin. And they'd be akin to putting a wet, wrinkled T-shirt in the dryer. The same way you get shrinkage of the cotton fibers in the dryer, these provide shrinkage of your own collagen and elastic fibers.
So when you're asking yourself, as I do too, when I'm watching like the Kardashians and watching all my favorites, they are doing these treatments. They are not just using a cleanser and a good lotion from CVS.
You know, So aside from my Indianapolis office, we have an office in Santa Rosa, and I do consultations in Beverly Hills and in Newport Beach. So I know, we're a fairly small circle of plastic surgeons around the country, and so I know the majority of doctors who have taken care of the majority of people you're mentioning. And
right.
So there is nothing you can put on your skin or put in your mouth that when you have the gravitational change is going to make you in your 40s to 70s look like, some of these people do. So
yes.
So after we do the DOT, again, we've talked about regenerative medicine and cellular medicine and stem cell therapy. There's a line of topical additives that we can add, one of which are referred to as exosomes. And these little protein packets are really a tremendous way to stimulate, again, your own fibroblasts to make new collagen.
This is next level.
Next, from the dot, we can use a line of technology called radio frequency, which is the deepest form of penetrating electrical energy that I could provide to your body while you're awake that you'll tolerate. So the intracell is a needle radio frequency system. When I put my foot on that foot pedal, it releases 50 little 0.1 millimeter needles into your skin. And a fraction of a second later, it fires radio frequency energy at the level, again, of where your fibroblasts live. So again, it's a tremendous way to improve the tone and quality. If you just need, again, a little bit of freshening, the intragen is more for around the eyes and for some of the fine lines around the neck.
I'm like making a list. I'm like, I need all these things.
If you have unwanted pigment or unwanted blood vessels, as we age, our skin thins, and so you start to see the thousands of blood vessels that live in the skin.
Yes.
So the Aerolase is an amazing laser for taking care of unwanted pigment, unwanted lines, and for acne as well. One of the last new things that we'll talk about is really 3 systems in one.
Okay.
Again, another form of radio frequency. And this is referred to as really radio frequency assisted lipolysis, because we can melt fat with this. We can also shrink skin.
Is that Paula Abdul I see over there?
Paula Abdul
hold up.
Yeah, she's a spokeswoman
'Cause this woman
for Body Tight.
She looks incredible. She doesn't age, so whatever she's doing is working.
So the Accutite, again, we can make a tiny little stab incision in one of your crow's feet.
Okay.
A little radio frequency needle goes under the skin, and a temperature monitor on the surface, and it also monitors something called the impedance level of the radio frequency. So it's a safety feature. So we can melt the eyelid bags. There's a condition called malar festoons that this helps with. It also improves the tone quality of the skin. Face Tight, again, is a non-surgical way to tighten up the neck skin.
Yes.
We can also give results comparable to minor facelifts. With the Body Tight, we're able to, many people have sagging skin in their arms.
You don't want the wings like when you wave bye to someone, the flapping in the wind.
So we can tighten up the arm skin.
Wow.
A little bit of the behind and under the bra fat.
Okay.
We can improve that. Inner thighs. Many people come in and say, my bum used to be behind here. Now it's in my inner it's in my inner thighs. So we can help with that.
Yes.
Fine lines around the knees. Many people are bothered by. So there's really no area, head or below the neck, now that we can't tighten skin, that we can't melt fat. One thing we haven't talked about, cool sculpting and cool tone.
Yes.
So if you just have a tiny little area of fat in your abdomen, your thighs, your arms, under your chin, cool sculpting uses cold therapy again to damage the fat cells. So that's an excellent option. There's its cousin now is called Cool Tone, and that can help us give someone, once we rid them of the fat, we can tone their rectus muscle, give them a little bit more of a six-pack.
And that's important for people that really work out, exercise. I have done cool sculpting, and I love it because there's just some areas that won't bulge. I feel like you lose weight in certain areas and then some others, so it just helps you out and really gets everything moving. So I think that's awesome.
Well, we've made you look 19 again, I think, and so it's really...
Dr. Chernoff, I have to ask you, what is a day for you like? Because if we mess up here at Wish TV, it's like, we said the wrong thing. But if I know you never mess up, but how do you handle your stress? Because literally you're doing things, you're working on people's faces. I mean, earlier when we began this episode, you're talking about tongues and, how do you maintain calm and stay so focused?
So first and foremost, I've been blessed by being trained by some of the best surgeons really in the world. But all of them early in our training really stressed the fact that we're here to take good care of people and not just do things to people. So that's really what I live by every day. I'm blessed in that after all of this time, I genuinely, without hesitation or reservation, can tell you that I love what I do. Every day is different for me. But whether it's a facial, whether it is Botox, a filler, whether it is the salt facial, Accutite, Body Tight, whether it's surgery, I worry about you from the moment I touch you until the time that you've healed. And if any surgeon ever says to a patient, "Well, I never see untoward effects or complications," they're either lying or they don't operate enough.
Right.
I'm blessed with a bicoastal presence. What being in Santa Rosa and Indianapolis allow me is the privilege of doing what I love the most, and that's to operate every day. So between my two centers, I do probably 750 to 1,000 cases a year. The accepted complication rate in our field would be about 1% to 2%.
Wow.
So every year, 1% to 2% of my patients don't heal how I would like them to, or how perhaps they would like to. What they know is that we will always take care of them. What they know is that, and I think that's the confidence that as a surgeon you have to let patients know, that there's nothing that can happen to you that we can't fix.
Oh, see, I love it. And you have
help.
such a calming voice too. I mean, just your presence alone, like, you're in good hands.
And then lastly, I think any success that I've achieved, I really would attribute to my mother. I had a great mom, and humility. There's so much arrogance in my profession, and humility was very important to my parents. My older brother's a family doc in Canada still. And so I think our patients also find out from the moment they meet us that I'm no different than you. I just really have a keen desire to take good care of you and not just do things to you.
But Dr. Chernoff, you are pretty much a little rock star.
You're kind.
So, thank you so much for being our special guest. And where can everybody find you and find more information to come see you?
So you can go to drchernoff.com, for which both of our locations, or drchernoff.com, as well as chernoffplasticsurgery.com. You can come in for a complimentary consultation. We're always happy to see you as many times as you like, without obligation. I'll see you as many times as you like, and help you make the best decisions for you, even if that means doing nothing with me, because then I've done my job for you.
Absolutely. Well, I just made a huge laundry list of all these new things I want to do. So thank you.
You don't need a damn thing.
You're so sweet. We adore you. Thanks for filling us in, because this could be overwhelming. That was very mind-blowing and amazing, just like you. Dr. Gregory Chernoff, thank you so much for being on this episode of Behind the Eight, All Indiana Podcast Network. Until next time, bye-bye.
Check out more podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com. allindianapodcastnetwork.com.